Hi friends, I am Dr. Vishal Gupta and I am a consultant pulmonologist at the Chest Care Clinic Kharghar in Navi Mumbai. Here are 5 signs that your breathing problem will need an urgent medical doctor's attention. Point number 1 is if there is a breathing problem and the person is having using of all his neck muscles, his chest muscles, and there is visible sweating. That person is definitely out of breath, and this person can have other problems like chest pain, breathing difficulty, along with cough, with wheezing. This can be a sign of an asthma attack. So it's important to know this problem and to see the doctor as soon as possible because this can get quite serious. Number 2, a finding of wheezing or coughing that the person is having in every spasms or continuously over the night or over the day. It is usually associated with some mucus production, and it is because of the asthma or COPD the mucus is getting impacted that is causing this problem. Usually patients are advised not to try to take care of it on their own and always see a doctor as soon as possible, because if it is urgent then a doctor can help you solve this problem very quickly and very easily. Number 3 is if there is any loss of consciousness. If the person is feeling giddy and has to lie down after a breathing episode or a chest heaviness episode, it's usually a sign of either syncope or in cases of a very severe pulmonary embolism or a respiratory distress. This can become critical very easily. So it is important not to ignore it, but to discuss with the doctor as soon as possible, either on the phone or physically meeting the doctor in an OPD or in an emergency by ambulance. Number 4, if the person is having blue lips or he's having a dark discoloration on his palms, on his fingernails, that is an indicator of lack of oxygen to your body. It will probably mean that the heart is not able to supply the body with blood properly, or the lungs have failed, or if there is some other problem which is there. Obviously, many of these issues you cannot handle them by giving any tablets, any injections, any syrups, and this definitely will need a doctor to either visit you, or you should visit your doctor as soon as possible in an ambulance. Preferably the oxygen level should be checked and oxygen can be given to this particular kind of patient. If a person is experiencing confusion or disorientation, and if the person has had a history of respiratory problems, if the person's problems have been increasing over a period of time, this is also a sign of a chronic respiratory distress. But this respiratory distress are very difficult for people who are fragile to tolerate. So you should always discuss it with a doctor, a pre-planned episode, if you are going to travel or if you are going to go outdoors. But if it happens urgently in a public place outside, there should be certain protocol medications which should be with you, which you can take in an urgent situation. Always meet your doctor as soon as possible. If you cannot find a doctor, if you cannot find your regular doctor, please contact a local hospital, a local doctor as soon as possible, because these situations can become life-threatening. So it is important that we identify them quickly, treat the patient quickly, and get them better as soon as possible. So what should you do if someone around you is having any of these breathing problems which I mentioned? The first thing is call for help. Never attend to anybody who is this severely ill alone. So you should definitely call for a doctor on the phone, or call an ambulance, or ask the doctor for a home visit if it is possible, or go to the doctor as soon as possible if you have the facility. We usually don't recommend people carrying the patients who are unconscious on their own, because there can be certain hazards to them and to the ones that they love. So you can actually create more problems for your patient. Number 2, so what should you do if someone you know is having any of these problems around you and you need to take care of them in an emergency? If this is an emergency, number 1 is always call for help. Ask other people to join your help, because if you are doing it alone, it is going to be very difficult for you to handle all the different possibilities, all the different things to be done at one time, and there has to be somebody who is supervising and somebody who is giving the care at the same time. So it is always a team approach. But if you're doing it alone, you're likely to make more mistakes, you're likely to get very panicky, and that is not a good thing in this kind of situation. Number 2, if they are unconscious, please don't move them on your own. Okay, just give simple jaw thrust. Call for basic life support if you know it. If you don't know it, always go to a help source as soon as possible, or call for ambulance, which is a professional service. Number 3, clear the area around the person, because if it's in a public place, lot of people, a lot of bystanders will come and start looking at what is happening there, and they will create more crowding. This creates more problems for the people who are giving care and the people who are trying to help, actually giving the person CPR and the person's breathing. So it is important that those people who know the life support should be there, and those can stand far away and give some place for people to act, especially the medical services if they are coming in and going out and giving care. If somebody you know is having this problem at home, and you know that they have been using inhalers, or you check the pockets of the person and find some inhalers or some medicines which are given for inhalation, you can give up to 4 to 8 times of these medicines in the emergency if the person cannot take it at his own. A child, an elderly person can get huge benefits, and you can shift them to the hospital safely before something critical could have happened. Number 4, don't ever leave a person who is breathless on his own alone. This person cannot shout, he cannot call for help. So obviously understand that if somebody is going unconscious, they are not likely to shout and before they go unconscious. It is basic knowledge that when somebody is having a breathing problem, they should have somebody watching them, just talking to them, calming them and reassuring them. That is the best that you can do in a difficult situation. If you have less medical knowledge or no medical knowledge, it is probably better than trying to apply the medical knowledge in the wrong way. So don't give oxygens unnecessarily when a person of COPD is having exacerbations or having a worsening of situations, unless a doctor has recommended it. So it is important that in a difficult situation, calm the person down, call for help, and definitely when help arrives, allow them to help you and to take the patient to the respiratory center where proper help can be delivered. Number 5 is always keep a medication list or your drug list with you updated, so that anybody who is trying to help you, supposing I am the person who is a victim who is having a problem, but my medical history is well documented and it is kept on let's say my TV rack or somewhere on the refrigerator, anybody who can access that can know what is my medical history, and the doctor can know what my problems are, even if there was nobody in my family or nobody around me to help me in that particular situation. This is particularly important for the elderly people who are living alone or those who are living in pairs, so in the couples. So it is important that these basic knowledges are applied, and if it has not been done, please try to get it done as soon as possible. Always have an emergency number or an emergency contact information to be given to those who are around you, or if it can be given in your mobile phone, and those who can access it can have the access and passcode also to it. Please remember that this information is only for a medical use, and always the important things are going to be discussed with your doctor. Please don't take it as medical advice, and don't try to teach others based on this video about how to give medical care. I hope that this video was found useful, and if you would like to hear more such video and more such content, don't forget to like, share and subscribe to our channel on YouTube and Instagram. Till then, I hope you have enjoyed this and have a nice day. Namaste.